Good afternoon. My name is Beate Lichtwart. I'm from the UK Data Service at the UK Data Archive, University of Essex. And today's webinar is about longitudinal data in the spotlight. So the roadmap for today's talk will be as follows. First, I will talk about who we are. So what is a UK Data Service, basically? Second, what sort of longitudinal data are available to you via the UK Data Service? And third, where would you go to find and access these longitudinal data, related resources and help? Let's start. So what is the UK Data Service? The UK Data Service is a comprehensive resource funded by the ESRC, and it is a single point of access to a wide range of secondary social science data. We provide support, training and guidance, and of course, mainly we also disseminate the data and we disseminate the data. So this is our UK Data Service website. I just want to, okay. So this is the website of the UK Data Service, and you might have seen that already there's a disclaimer for the COVID-19 exceptions and exceptional circumstances and how we are dealing with those. Here is an information where you would find the slides and the recording of today's webinar. So you don't need to scribble anything down. You will get the slides following today's webinar. And you can also actually go to news and events on the top right-hand corner and click on events. And okay, now it is under events, but it will be from tomorrow onwards under past events, the subfolder on the left-hand side. And here the webinar data and the spotlight longitudinal data. So there you will find actually the recording and the slides of today. But also you can go to our YouTube channel and you find the recording there as well. So who is the UK Data Service for? It is basically for academic researchers and students. It is for government analysts. It is for charities and foundations. It is for business consultants, independent research centers, and think tanks. Our data sources come from official agencies, so here mainly the central government. So the Office for National Statistics is to be mentioned here. From International Statistical Time Series we have data, but also from individual academics. So if you have an ESRC research grant, 3 months following the end of your project, you will be asked to submit the data to us for secondary data analysis. So you need to deposit them with us once your project is finished. That's part of the deal with the ESRC. Then we have data from market research agencies. We hold public records and data from historical sources. And we have access to international data via links with other data archives worldwide. The types of data collections we hold, and here I just want to briefly give an overview. I know we are focusing today on longitudinal data, but just to give you a first flavor of what we hold. So we hold survey microdata, and here cross-sectional data, then panel longitudinal data, which is the topic of today, international microdata, and the second group is aggregate statistics, international macrodata. Third, we hold census data, and here we distinguish between aggregate data, flow data, microdata, and boundary data. And fourth, we hold qualitative and mixed methods data. And by this, I mean in-depth interview transcripts, diaries, anthropological field notes, answers to open-ended survey questions, audio-visual recordings, etc. So this is a structure of the key data. So there are UK surveys, which are large-scale government-funded surveys, like the Labour Force Survey, for example, or the Annual Population Survey. Then the longitudinal UK service following individuals over time. We have international macro and microdata, qualitative and mixed methods data, census data, business microdata, and here these are mainly covering all the secure lab data, administrative records, and also we have access to controlled international microdata via our safe room. And here at the moment we have access to IAB data and CSD data that are German and French controlled microdata. This structure you find on our website. So here you see I have provided the link, and this is a screenshot. When you go to use data, key data, you find then exactly the structure I have just shown you. And in black, you find highlighted longitudinal studies, which is the topic of today. Now, before we start with that, I quickly want to mention the International Data Access Network, which is a collaboration between 6 research data centers from 4 countries, France, Germany, the Netherlands, and the United Kingdom. And the aim here is to facilitate research use of controlled access data between these RDCs and countries. And we do this via reciprocal provision of safe from remote desktop access. This is actually fantastic news. At the moment, of course, our safe room is closed due to COVID-19 circumstances. However, once it is open again, you can access the data from there. And here I have just provided some links. So when you get the slides, you can actually click on it and you can see what is available there. I'm mentioning that within the longitudinal data webinar because they also have longitudinal data. And if you want to do an international project, then this is the place to go. So I'm not focusing on the details, just to mention a last one, the National Educational Panel Study, NEPS, which is a very important German panel study and very up to date. So this one is also available via the IRB. Now, starting with longitudinal data in general. So longitudinal surveys involve repeated surveys of the same individuals at different points in time. They are large samples and they are nationally representative, the ones that we hold. Of course, all the longitudinal studies suffer from attrition. And that is addressed by adding new respondents regularly to keep numbers up. Longitudinal data allow researchers to analyze change at an individual level. They're a bit more complex to manage and analyze, but they're definitely worth it. So some examples of longitudinal data we make available are, and here I have highlighted in green, the birth cohort data. So there are 4. The 1958 National Child Development Study, NCDS, the 1970 British Cohort Study, BCS-70, the Millennium Cohort Study, MCS, and Next Steps, which is formerly known as a longitudinal study of young people in England. So we also have the British Household Panel Survey and its successor, Understanding Society, or UK Household Longitudinal Study. And then we have some others like Elsa, the English Longitudinal Study of Aging and Families and Children Study, Our Future, LSYPE2, Growing Up in Scotland. And I will also refer to Closer, the Cohort and Longitudinal Studies Enhancement Resources. Open. So this is a website of the CLS, the Center for Longitudinal Studies. And here you can see the 4 birth cohort studies that I have mentioned, the 1958 National Child Development Study, the 1970 British Cohort Study, the Next Steps, and Millennium Cohort Study. So you also see a link here, and I have put a little box with a podcast of the CLS, and I think that's quite a nice touch that you can listen to podcasts related to these birth cohort studies, not just articles. And basically, all of these British birth cohort studies are aiming at making it possible to analyze the impact of childhood conditions on education, later life health and economic circumstances, and understanding children and families in the UK. So here I have listed all the different ages that people were surveyed at. However, I think this is quite tedious to look at. Let's just take from this slide that there's a wide range of social, economic, health, medical, and psychological issues that are surveyed. And looking at the ages, I think it's much easier using this sort of timeline here. So I have provided all the timelines for NCDS, BCS-70, MCS, and Next Steps. And then if you wanted to analyze the data, it's quite easy to see are there similar ages and what are exactly the ages that they have been surveyed for your comparison, your inter- and intra-generational comparisons. So the National Child Development Study has become a unique resource for investigating social mobility and the impact on later life of childhood conditions. And some data collections, they have a specific focus. So for example, there's They look specifically into partnership history, employment history, social participation, and identity, death, parent migration, etc., etc. And the same follows through the other studies. So the BCS is very similar in design and coverage, obviously, because they are designed to make the comparison possible. But they again have some data collections in the series that have a special focus on education, partnership, employment history, etc., etc. The same for the Millennium Cohort Study. And because there was quite a long gap between the British Cohort Study 1970 and the Millennium Cohort Study, Next Steps fits quite nicely into it with 89 as the year people were born. I would like to also mention the Millennium Cohort Study, age 14. Why do I want to mention that specifically? Because this is the first large-scale population study in the world to incorporate objective measurement of physical activity using accelerometers alongside self-reported time use for the same period into a social survey. So that's actually quite unique and quite innovative. They also have an online diary and a bespoke smartphone app. So, of course, I figured, well, if we want to survey 14-year-olds, what do we need to do to make it attractive for them to answer? And the app, for example, is one of the solutions they came up, and it's actually quite popular. So, and then, of course, you have all the results like, excuse me, please. Teenagers shun homework for social media and video games, new survey finds, or is this a misspent use? So how new technology is shedding light on what teenagers do all day, etc., etc. But what is really interesting, have a look if you want to use that data set at the technical report, because it's all explained how they have used all these innovative technologies to actually get the data. So all these studies are obviously designed to inform policy. And one of the big topics was, for example, children's mental health. Excuse me, please. And there's, for example, a short video here. I've provided the link, and also some articles just to illustrate the impact. Also, part of informing policy was a Read On, Get On campaign. And here it was quite interesting. There was a fear that 1.5 million British children will reach the age of 11 unable to read well by 2025. And that has prompted the launch of this campaign. And it was actually quite successful. And the interesting bit is obviously this was all triggered by the fear that it would result in huge cost that would need to be covered by the government. So also the SRC has commented on that, and it is actually quite clear, and Dr. Alice Sullivan has summed it up quite nicely. If young people are encouraged to discover a love for books, it could alter the course of their lives regardless of their background. And so we have, for, again, Millennium Cohort Study, I just used that as an example to illustrate what all has been done in the past and at present in order to enhance normal surveys. So basically here the data sets have been linked with education administrative data sets, and I have just listed a few for you to see what Key Stage 1 and Key Stage 2 data sets have been linked. And meanwhile, there are so many that I have just used a screenshot of all the different data that are excuse me, accessible. And you can see here, you have survey and biomeasure data, you have linked and administrative data. And when you click on the little arrow on the right-hand side, then it would open up and give you all the data sets related to that. They don't fit on 1-2 slides anymore. And we also have the close-up work package 1 and 2 harmonized data sets. I will get to that later on. And geographical data and even more smaller geographies linked to it. So that's actually quite encouraging to see how that develops over time, and they're quite flexible and adapting to the changes, which is actually quite nice, and they keep up to date. So biomedical sweeps have also been done. Here the example of the BCS 70, and the study number is what you find in our data catalog, so you would need to look for 8288 if you looked for that particular one. But again, just to illustrate, there is, for example, a 16-year follow-up reading and matrices tests dataset from 1986, for example, and it is explained here what is in there. Just to give you an idea of how it looks. So basically, you don't expect to find in every wave or sweep the same topics. So for example, in the first sweep here of the Millennium Cohort Study, you find birth records and the interview with the mother and the father. And in the second one, you find information from the child and older siblings, but you also have medical records linked to it. And then in the third, you find also educational records linked to it, and so on and so forth. So it's basically a modular design, if you wish, and that is actually quite nice. It works quite well. But also, there is a combination with qualitative data. So it's not only quantitative data. There are bits that are qualitative. So for example, there is a NCDS 8 in 2008-9, and the title is Imagine You are 60. So basically what they wanted is to get a view of the next decade for 50-year-olds in the 1958 British Birth Cohort Study when they enter the third stage, or third age, sorry. So it was an open-ended question in a self-completion questionnaire, which asked individuals who were 50 years old. So imagine that you are now 60 years old. Please write a few lines about the life you're leading, your interests, your home life, your health and well-being, and any work you may be doing. So, and this question parallels another one that was asked of the cohort members at NCDS 2 when they were actually 11 years old, who then wrote about their imagined life at the age of 25. So that actually provides some really interesting new information to understand the aging process, and it is a way to A, code cohort members' pessimism or optimism about the future, B, understand concerns of cohort members at this age, and C, it will also allow a comparison to be made between actual circumstances at 60 and future as it is imagined at the age of 50. So actually quite interesting stuff. And just an illustration, what has been said. One, for example, mentioned, I will still be working, building my company up so my son can take over. Health, okay, married to my wife for 36 years, love her to bits. Kids have finally moved out, life is great. No money props, traveling a lot. Well, that sounds rather positive, doesn't it? Another one said, hopefully I will be retired, do a little voluntary work, socializing with friends, shopping, and enjoy lots of holidays in the sun, enjoying my grandchildren. To be honest, now reading that all has been said before COVID, obviously. Now, another bit of impact, another snippet regarding impact. So there was, for example, BBC One celebrating the childhood dreams of NCDS members and having it in a movie. You can look into that in more detail. But now, let's get to the newest topic that moves us all daily for a while already and will for a while. So there are also data on COVID-19 in all of these surveys. I come to that in a minute. So I just wanted to open up the topic by giving 3 examples of publications. One, parental involvement in homeschooling and developmental play during lockdown, initial findings from COVID-19 survey. Another one, finances and employment during lockdown, initial findings from COVID-19 survey. And another one, a podcast in the series of podcasts I have just mentioned before. So there is a COVID-19 survey in 5 national longitudinal cohort studies. So the Center for Longitudinal Studies carried out an online survey of the participants of 5 national longitudinal cohort studies in May 2020. And over 18,000 study participants took part. So this so-called Wave 1 data is available via us, via the UK Data Service at the moment. A second wave is sent out in September. It was sent out in September, sorry, it's October. And Wave 3 is planned for early 2021. So I have provided here the exact title of that survey and also the link in our data catalog where you would find it. Now, the Wave 1 covers the time before the outbreak of the pandemic in March 2020 up until the lockdown restrictions in May the height of the lockdown restrictions in May 2020. And the Wave 2 will follow on from that point in time until late summer, early autumn 2020. And then again, the last bit, not the last bit, but the following bit will be covered, excuse me, from that point onwards until January 2021. So very up-to-date data, which can be analyzed regarding COVID-19. We have several pages on the UK Data Service webpage regarding COVID-19 data, and I have provided here the link and also just a screenshot. So we have special license data, COVID-19 data, secure lab data, these three distinctions. But when you click on COVID-19 theme page, then you find a very useful source. And that is COVID-19 data. So you find a table with the study name, the topics, and further information. And that's actually really quite useful, because you can then see how many studies have reacted to COVID-19 and are actually now providing excuse me, extra data regarding COVID-19. Also, Understanding Society has a COVID-19 study that's also in that list. And Professor Michaela Benswald, the director of Understanding Society, sums it up actually quite nicely. So with the current coronavirus situation in the UK, there's an even greater need for data about the experiences of the whole population. The Understanding Society COVID-19 questionnaire allows researchers to explore how the pandemic is impacting individuals, families, and communities across the UK through our large and representative sample of the UK population. I will come to that, how large the population actually is. It's fantastic research material. So how does it work? So from April 2020, people have been asked every month a very short questionnaire to get a grip of what's going on. And so it's a regular survey of households in the UK. And the aim obviously is to study the socioeconomic and health consequences of the COVID-19 pandemic in the short and in the long term. So it has been monthly from April until July, and from September onward, it will take place every second month. And that actually complements the annual interviews of the Understanding Society study. So the interesting and really beautiful thing is you can link the data to the same individuals of Understanding Society normal data, so the main data sets, and that absolutely enriches the whole thing. So it's fantastic research potential. Now let's just get into details. I didn't introduce Understanding Society or UK Household Longitudinal Study yet. So it started in 2009, and it's a successor of the British Household Panel Survey, which ran from 1991 to 2009. So basically, because the respondents have been surveyed also from wave 1 of Understanding Society, you have now data from 1991 until today. And whereas before 5,500 households were surveyed, now it is 40,000 British households. That's the largest study. And so basically incorporating the BHPS retains the longevity, but also added to the sample size, obviously, and to the scope of the study. So there are new components like the innovation panel, for example, and there's greater detail on ethnic minority groups, for example, qualitative data are involved, and biomedical data collections are added as well. So the coverage includes current employment and earnings, employment status, parenting, childcare, family networks, benefit payments, political party identification, household finances, environmental behaviors, consents to administrative data that is linked to the main data set. So just to showcase the impact, there are several topics, but obviously I think at the moment the most relevant topic is COVID, unfortunately. And there are several briefings available on the website as well. And here, for example, I have just copied 3 different bits and snippets. One briefing note on the ethnic differences in effects of COVID-19 on household and local context. And health and caring is one topic of another briefing note. And there's also a video how to use the COVID-19 survey, which is actually quite nice. So please have a look. I provided the link there. Biomarkers, genetics, and epigenetics was a topic before COVID, and there's a very interesting page on that. Here is the link to it, and also some summaries. Here's an overview, which you can find in the Understanding Society Biomarker User Guide PDF file. I have provided the link here from study number 7251. You can see it on the left-hand side corner. And this basically shows you which biomarkers are available in Understanding Society, and also the applications, because not everybody knows what applications are associated with that. So that's actually quite useful. We also have a little video, a webinar, an introduction to survey data on biomarkers in our YouTube channel. The link is here. And so the nurse health assessment data, for example, are available in that particular dataset 7251. And on the left-hand side, I have listed all the different nurse health assessment topics that have been addressed. So, as I mentioned before, linkage is a huge topic. There are 3 types of data linkage. One is geographical identifiers, another one is administrative data linkage, and here that is education, health, transport, economic circumstances, etc. And obviously then organizations here to schools, for example, that children attended or recently attended or attend. There is an overview on the website of Understanding Society regarding the data linkage phases and what is realized so far, where consent collection has happened, and the status of the whole plan. So you can keep yourself updated about that. Now, the Understanding Society and Harmonized BHPS dataset, the main study number is here 6614, is actually including, as I said before, excuse me, the Understanding Society data and the BHPS data, and then basically merged together as and where possible. And here you find the different secure access versions. I think that's actually quite interesting, depending on what you want to do. I can't go into detail. I'm sorry, I'm rushing a bit because I would like to give you as much information as possible. Another of our longitudinal studies is the English Longitudinal Study of Aging. And this study collects data from a representative sample, roughly 10,000 of the population aged 50 and above in England, on a range of indicators, and here specifically health, economic circumstances, well-being, social participation, etc. So there is quite a rich data source for that. And I have listed some key findings. Let's just mention one, that the majority of people over the age of 50 report hardly ever or never experiencing feelings of loneliness. Well, this is also actually a statement from before COVID. I think that has changed dramatically. Now, Elsa is a longitudinal survey of aging and quality of life among older people that explores the dynamic relationships between health and functioning, social networks and participation, and economic position as people plan for, move into, and progress beyond retirement. Now, why is this of so much interest? Well, excuse me, 1 in 3 people in England are now over 50, which means it's really important to understand what life is like for England's aging population. And actually, Elsa helps the government to plan healthcare services and pension systems to best meet the needs of this growing population. So the main objectives of Elsa are to construct waves of accessible and well-documented panel data and provide these data in a convenient and timely fashion to the scientific and policy research community, describe health trajectories, disability and healthy life expectancy in a representative sample of the English population aged 50 and over, examine the relationship between economic position and health, investigate the determinants of economic position in older age, describe the timing of retirement and post-retirement labor market activity, and understand the relationships between social support, household structure, and the transfer of assets. Now, there's also a set of 558 transcripts of short essays collected from respondents to the Wave 3 life history interview. They're provided in RTF format, and they were written in response to section 3. So basically, the task here was thinking back over your life with its wide variety of enjoyable as well as difficult experiences. Please write about 3 aspects of your life that have been especially important to you and how they affected you. Very interesting thing. Now, again, also Elsa has responded to COVID-19, and there is an English longitudinal study of aging COVID-19 study available, Wave 1 from this year, obviously. And the topics that are covered include demographics, mental health, financial security, COVID-19 related health, employment and work, financial situation, volunteering and care, physical health and health behavior, social connection, isolation and technological inclusion. I think that's a very interesting point here. Income, pension and retirement. And I provided the link so you can find it easily. I also would like to mention that Elsa feeds into the gateway to global aging data. So basically here you have an international comparison of the global aging data, and you can, they are basically harmonized here, and it's possible to make an international comparison. It's fantastic. We also have just quickly back. We just have a webinar on this gateway to global aging data advanced workshop that was done in the past, and there's a link to our YouTube channel. You can find that. I also listed, if you remember, in the beginning of all the examples, or some examples for our longitudinal data that we hold closer. So the cohort and longitudinal studies enhancement resources, which basically aims to maximize the use of longitudinal data, the value and impact that they have. So they deal with data harmonization, data linkage, and training and capacity building, for example. Here is a nice overview. It's a timeline of studies that they hold. And so here you can see which are all included. Again, the link is there. And what is actually quite nice, we also have the harmonized longitudinal data from Closer, and we make them available via the UK Data Service. So we are very, very pleased to announce the harmonized data sets that have been created by Closer. So work package 1, for example, there are 2 work packages so far. Work package 1, for example, has the data sets harmonized, and here focusing on height, weight, and BMI across 5 UK's of the UK's cohort studies, and then they are listed here. So the NSHD, NCDS, BCS70, MCS, and ALSPAC. And I mean, it's really, really, I will just quote Alison Park here, saying, as an experienced researcher, I know the huge challenges involved in creating harmonized datasets from different data sources and the importance of ensuring the methods used can be usefully exploited by other researchers. Longitudinal harmonization provides fascinating insights as to how the UK is changing over time, and I'm delighted Closer is helping make this work easier, and actually it does. So here are some of the data sets we make available. You can study that at your leisure. Another one is Growing Up in Scotland, another longitudinal study. And I mean, as it says, it follows several cohorts of Scottish children from the early years through childhood and beyond, and focuses on health, neighborhood development, education, leisure, friendships. And there's also constant thought from parents to link data collected from them and their children to administrative data held by health and education authorities. So in the past, they have, for example, focused on changes in language ability over the primary school years. That was a huge topic. And there were several initiatives. So, for example, Book Back and Play, Talk, Read. And then it was investigated whether that had an incentive and an effect on the ability to read and write. And actually, it had an effect, a very positive effect, very successful. And I have listed some key findings here. Some not so surprisingly, but others actually quite useful. So another issue they looked into was physical activity levels amongst 10 to 11-year-olds in Scotland. And also they had quite an interesting way of measuring things here. So for example, they incorporated GPS data. Again, I would encourage you to look into that. I don't have the time to unfortunately mention everything I would like to, but just to give you a hint. Just to give you a flavor again, what sort of impact GUS has, just to mention the title, Growing Up Healthy in Families Across the Globe, Cross-Cultural Harmonization of Childhood Risk Factors using longitudinal studies from Ireland, Scotland and New Zealand. I think that's highly, highly interesting, and I can only recommend that. And some others are listed here. Please have a look. Now, how would you find longitudinal data when you come to the UK Data Service? How would you go about that? So there are different ways. One is search for key data, and here you would click on Get Data, then on the left-hand side, Key Data, and then you see, as before, longitudinal data. So I have also highlighted this cover data. You can also click on that. A second option is you go to the data catalog, and that's, you have seen before, is a black box, and there's a white box inside the black box, and there you enter your search term. So you can look for studies in series. And here, for example, I have specified the data type as cohort and longitudinal studies. And then you have 57 series, for example. And you can also go to the variable in question bank highlighted here. And then you can specify here, for example, as I was looking for highest education in the European Union, and then I get 18 results. And you can also here sort it by earliest or by relevance. I mean, you can sort by different, you can sort it in different ways. And you can actually then add it to your variables. There's a little basket, like a shopping basket, only that you don't pay. And then you can actually analyze afterwards what is in your shopping basket. So basically you can compare the variables you have put in your basket and see the different questions and the different codes and labels and see whether it's actually comparable. For that reason, it's very good. Unfortunately, it's not comprehensive. So you don't have all the data sets in this variable in question search. So I mean, you can have a look, but it's not comprehensive. Don't use it as your only way to search for data sets. Data access. Who can access the data? Basically all registered users. However, which data can be accessed and the particular access conditions vary according to your user type, to the usage project or the characteristics, meaning here whether it's a commercial or non-commercial project, and then the specific data access conditions that are attached to the chosen data. So data access is via the web. It's freely available to use in higher education institutions, and we supply the data in a variety of formats. Accessing step by step. I don't want to go into too much details. There are webinars and video tutorials about how to do that. Basically, you register with us, you agree to an end user license, you select the data, specify the project, give 30 words, I think, for the description of the project, then download the data or place an order if it is special license data or secure lab data, and then you need to undergo different processes. The whole application process is described on our website here under Get Data, how to access, and on the left-hand side, download and order. And you can also see access to Secure Lab is slightly different. You would need to click on something else. So the data access conditions that we have are end user license, special conditions, special license, Secure Lab data access, but that involves then approved researcher training, etc., etc. So we can talk you through that on a different occasion. Just to give an idea, we have 773 open data sets, we have 6,041 safeguarded data sets, and 215 controlled data sets. Controlled means secure lab data where you have to undergo a longer process. So the end user license everybody will sign, reminds you not to share the data with anyone who's not authorized to access the data, not to use the data for commercial purposes except when you have the permission, not to try to use the data to identify individuals, households, or organizations, cite the data correctly, very important, and not to disclose your login details to others. Special license access is slightly different, but you will be guided through that by our access team once you apply to that. Secure Lab data access, I have mentioned before that Secure Lab data are not available for download, so that requires an accreditation. Access requires an accreditation as an approved researcher, and you have to have a face-to-face training. Actually, now it's an online training, so we do the safe researcher training online, and it's half the length. That might be a plus. And so you have to sign an agreement to the services user agreement and breaches penalty policy. All applications are screened by first the UK Data Archive and then the designated authority of the data depositor. So this is how it works for Secure Lab. You register, you order the data, you become an approved researcher, undergo all the necessary steps, then you complete the service agreement, you complete the training, you then get a unique login, you work remotely, and then you ask for an output release. Before you can have that, we will apply statistical disclosure control and make sure it is okay to be published. and then we can hopefully release it to you. If not, we ask for changes. Now, exploring data online, you can do that, for example, with Nesta. So that's an online data browsing and analysis system. So you can search, locate, browse. Again, unfortunately, not all data sets are in it. However, you can have a look by going to Get Data, Explore Online on the left-hand side, and then you also see other options like UKDS, Stat, etc. But coming back to Nesta, this is just to give you an idea of what you can quickly do. You can quickly tabulate your data, cross-tabulate your data, and have simple graphs done. But also, because we are looking at longitudinal data, you can look at time series here, for example, the General Household Survey, and you can see how many people had a degree or higher over time, and you can see how that has gone up. So, useful links to get started using Nesta. I have provided some links. Please have a go. It is actually not difficult, and you get a very quick feel for the data. What sort of support and resources are available? I see I have roughly 15 minutes left, but we would like to have some discussions as well. So let's just see what's most important here. We have video tutorials and webinars. We have, for example, student resources like the data skills module, and I have provided here the links, the link under the box. So the longitudinal data module, for example, which would last approximately 2 hours. So you would need to schedule 2 hours and set aside for working through that. So we have 5 units, and they cover what are longitudinal data, use cases, downloading data and getting started, preparing to work with the data, and analyzing the data. So we provide case studies, guides, themes, advice on managing and sharing data, teaching data, and resources. And we also have a help desk. I mean, at the moment, we are all sitting at home and working remotely, but the user support is still there. Video tutorials you would find by going to Use Data, Video Tutorials, and here you have case studies, data in use. You can see how data have been used. For example, if you want some inspiration, here I have just highlighted a few. Then if you want to look specifically for case studies based on longitudinal data, you go to Get Data, Key Data, and then Longitudinal Studies. And then further down, you find under Data Catalog, case studies relating to longitudinal studies. So this is where you find then relevant longitudinal study case studies. Teaching with data, again, go to Use Data, Teaching with Data on the left-hand side, and there you find information on how to do that. If you need more information, please get in touch with the access and support team. And if you want to look for longitudinal teaching data sets, you could also go to our catalog and just type teaching data sets and then specify on the left-hand side data type cohort and longitudinal studies, and then you would find relevant teaching data sets. Excuse me. And frequently asked questions are also available on our website. If you have any questions, contact us. The telephone doesn't work at the moment, but you can email us, and you can use our online forms, which I highly encourage to do, because that's the way that you get the quickest answer. So otherwise, email us, support@ukdataservice.ac.uk. So any questions? I have a chat here. So I have a question here. The process of harmonizing, does it change the depth of information? Well, I mean, obviously, I don't know whether you are, for example, referring to the English longitudinal study of aging. I have mentioned that that is harmonized and attempted to be made available across and comparable across countries. But yes, you will lose information in that sense that you don't have all the information available in every country. So you can then only compare certain questions which are available in all countries. So if you harmonize across, if you're now referring to the birth cohort data, if you are harmonizing across the different birth cohorts, it should be actually much easier because they are designed to be comparable. So the harmonization here basically includes, I don't know whether you've worked with longitudinal data before, but it's usually many data sets, and you have to select your information from each data set and basically merge it into one big data set that you want to analyze. And this is actually being done for you. So with the birth cohort data, the harmonized versions, I wouldn't expect much loss of information because they are actually coming from the same data depositor, and they have been designed with a view to have it comparable in the long run. Well, whether I'm aware of studies that have tried to link education continuity and life success, I would actually point you in the direction of Understanding Society, because it's a long run, and the birth cohort data, to be honest, unless you want to look into older age, but otherwise these two, because there is definitely education information linked to the main data set, so you can actually analyze how your education has then resulted in life success, however you want to define life success. But these data sets are really rich, and you can definitely do that. So Paul, you can use one of those studies or all, it depends on what you want to see, whether you are after certain cohorts or whether you are after certain ages in different cohorts, or however you want to see what has been going on. So yeah, definitely look into those. Has it been investigated? Yes, I think definitely. So I have tried to give you some snippets of research done using the birth cohort data and also using Understanding Society data, for example. And there is definitely research out there on that. So please check it out before you start doing your own analysis. You don't want to duplicate anything. But yeah, there's definitely research on that, yes. Okay, so what is the process of accessing geographical identifiers? So there are different data sets. I didn't go into too much detail about end user license data, special license data, secure lab data, but the more detailed your geography is that you want, you have to undergo certain procedures. But it depends. Have a look at the website and look into the data set that you particularly want, and then you will find all the different geographies listed and see which one you need. If you can't make sense of what you see online, please get in touch and send us an email and we will advise you. I hope that answers the question on that. Anything else? Let me have a look. Information on a similar study is run in another country. On Nicholas, what do you mean? Which a similar study to which study? Similar to which of those that I have mentioned? Dementia studies. I haven't particularly looked into this, but yes, I would imagine that in the Elsa study there will be information on that. So it would be part of one of these studies, or Understanding Society, it would be part of that to ask for information on dementia. But I think we also have dementia studies, but I'm not aware of one particular longitudinal dementia study is in its own. I think they are part of Understanding Society and part of the birth cohort studies and maybe Elsa. So you could have a look there. longitudinal data free to use? Yes, they are free to use for students and researchers at higher education and in institutions and further education institutions, and for academic research, obviously. So yes, all this is actually for free, which is fantastic news, I think. The MCSH 14 study is run in another country. Well, obviously it wouldn't be exactly the same study. But you mean whether there's anything that would be comparable? Well, I think what is presumably the most likely scenario is that you have longitudinal surveys in other countries, which include 14-year-olds, and then you could compare the variables and basically which questions have been asked, and see whether there is yes, a comparison. But I mean, in terms of educational achievement, there's definitely an international study available, but the leisure activities of 14-year-olds in all different countries, I'm not sure. Can researchers from other countries make use of the longitudinal data as well? Well, that depends. Yes and no. Yes, they can make use of what we call safeguarded data. So if it is end-user license data, and also some selected special license data sets are available from abroad. Secure lab data sets, or controlled data sets as we also call them, are at the moment not available from abroad. However, we are working on that. What I said about the International Data Access Network is actually working exactly on that. I'm involved in it, and I'm working on making data access points, setting up data access points in other countries' safe rooms, and getting agreements in place so that basically in future that will be possible. Yes, but it's a complicated process, and the data depositors need to agree on making these data available to researchers abroad. But that would obviously then just be possible, I mean, these secure lab data sets. Others are at the moment, yes, accessible from abroad.